Hi, I am here today to overview health systems of 3 different countries, the US, Germany, and Singapore. I will delve into how these countries attempt to meet the goals of a health system and how they provide the functions of a well-functioning health system. As suggested by the World Health Report, there are 3 goals for every health system. 1, good health. 2, responsiveness to the expectation of the population. And 3, fairness of financial contribution. In order to meet these goals, the World Health Report 2000 provides 4 functions for a health system. 1, provide health services. 2, generate resources or raise money that can be spent on health. 3, financing, as in pay for health services. And lastly, stewardship, as in to govern and regulate that health system. Now, the U.S. health system is a complex mix of public and private entities encompassing various for-profit and non-profit insurers and healthcare providers. It primarily operates through a combination of employer-sponsored insurance, government programs like Medicare and Medicaid, and a range of private insurance options. The system is designed to cater to a diverse population, but significant challenges persist regarding access, cost, and quality of care. The federal government plays a critical role in funding essential health function or health programs. Notably, it administers Medicare for adults age 65 and older, and some people with disabilities. Medicaid for low-income individuals and families, as well as the Children Health Insurance Program, or called CHIP, for children in low-income families. The Affordable Care Act significantly expanded the government's involvement by mandating health coverage and setting regulations for private insurance plans. State governments also have a substantial authority, primarily managing public health initiatives and overseeing the operation of Medicaid programs within those federal guidelines. So you'll see substantial differences in Medicaid programs state to state. They usually regulate private insurance markets, the state governments that is, license healthcare providers, and implement public health programs tailored to the local needs. Now, the U.S. has the largest health spending of all nations, 17.7% of its gross domestic product per capita, yet still struggles to give equitable access to all peoples without the financial burden of out-of-pocket costs, which is substantial here in the U.S., and also due to lack of accessible insurance. About 15% of the population is without insurance at this time. I looked into Germany's health system, arguably the longest running universal coverage. It has a dual structure involving both statutory and private health insurance. Germany's healthcare system is predominantly based on statutory health insurance, SHI for short, which covers approximately 86% of the population. The government plays a regulatory role in ensuring that all citizens have access to healthcare services, while the actual healthcare delivery is managed by non-government sickness funds, which are responsible for administering those SHI and their funds. The financing of the German healthcare system is primarily derived from mandatory contributions to the SHI, which requires both employers and employees to contribute. I think employees, it's about 20%, and then like 16% for the employers, and that's of their gross wages. So in addition, there's also their supplementary contribution, which averages about 1% of their wages. In addition, for those averaging above a certain threshold or making over a certain amount of money in Germany, private health insurance is available. Now, this is like an alternative insurance to supplement what they already have access to. There's only about 11% of the population that relies on this option. In 2021, total health expenditure accounted for approximately 12.8% of the gross domestic product, so kind of right in between that high end of what the U.S. spends. So still a significant amount of money into their healthcare system. There generally provides good accessibility with a large majority of their population covered under this SHI or private insurance. Coverage entails a comprehensive benefits package that includes inpatient, outpatient, preventative services. The biggest issues encountered with learning about Germany's healthcare system are the disparities, particularly regarding access to specialist care and regional variations, where like lower socioeconomic groups may face some increased challenges. And then higher income groups are usually granted access to higher quality care, especially with that PHI, which can create disparities in like the quality of the care. Other things that are becoming issues within that German healthcare system is the way they pay their physicians or their providers. Usually it's a fee for service basis, and it's regulated by the government. So some providers, due to those government mandates, are liable if that physician gives too many treatments to a certain patient that's tapped out on what they're able to do or what was mandated, or the physician would be liable for coverage if they give prescriptions to a particular drug and that's over the allotted money. So there is a potential challenge with maintaining quality healthcare staff due to those mandates. Now, lastly, I looked at Singapore, and this is what, so far, looking at different countries' healthcare systems, I have found to be quite well functioning. I haven't delved into France, but I've heard that is also doing quite well. But I do think with Singapore being a pretty small country, and as what I've read, a fairly homogenous in its like income variations compared to potentially like the U.S., that some of their challenges it's a little easier to go through or manage because of that lack of low income to high income gap. Singapore's health system is characterized by a mixed financing model, similar like the U.S., private and public sectors. It ensures a broad access to healthcare services for its residents. The Singaporean government, though is a unitary parliamentary constitutional republic, plays a central role in the healthcare system through the Ministry of Health, which is responsible for the public health system, ensuring access to good and affordable health care. The MOH, or Ministry of Health, it promotes health, coordinates the workforce planning and oversees the development of healthcare facilities to meet those long-term needs of the population. They also utilize different tiers of service, as well as they have a financing structure. So they have a MediShield. This is a mandatory basic health insurance that covers large medical bills, outpatient services. It requires patients to pay premiums, deductibles, and a co-insurance. Then the MediSave is a national medical savings scheme where citizens contribute a percentage of their income to a savings account, kind of like an HSA account that we utilize here in the U.S. That can be used for out-of-pocket healthcare expenses. MediFund is a safety net for those who cannot afford to cover their out-of-pocket expenses, ensuring that no citizens are denied access to medical care due to financial constraints. The government has expanded their health budget over the last 5 years, and it really has increased the country's quality of care, and as indicated by like these key health indicators such as increased life expectancy and reduced infant mortality rates. But even with this increased budget, Singapore spends only about 4% of its gross domestic product on healthcare, which is one of the main goals of a united healthcare system, is to keep the low cost but high quality care. So I do believe that so far Singapore is really doing a quality job in managing that system. It would be nice to see some of that organization and lack of fragmentation to be carried over into other countries struggling with high costs and lack of access to care. Thank you, and